Hey guys, Lance here, and today I just want to give a brief overview about what is Medicare on today's Medicare Q&A. So Medicare is a federal health program. It's funded by Social Security and Medicare taxes paid by employees. So as someone is an employee or as someone is going to work throughout their working years, they are paying Medicare taxes specifically to pay for Medicare when they get to the age where they can enroll in Medicare. So this basically provides health insurance for senior citizens who are age 65 and older. It also will cover in health insurance for younger people with disabilities and people with arterial lateral sclerosis, or ALS for short. Also those with end-stage renal disease or people who have kidney failure, they also may qualify for Medicare as well, even if they're under the age of 65. Now there are 4 parts to Medicare. There's Part A. This pays for hospital coverages and short-term respite care. There's Medicare Part B, and this is your outpatient coverage. Things outside the hospitals, doctors you visit outside the hospital, labs you get, therapies, and there's other things as well. But you can think of it as outpatient coverage. And then Medicare Part C. This is the plan that's managed by a private company that adds coverage to what Parts A and Parts B offer. So Parts A and B, you can think of those are 2 parts of Medicare that the government provides for. Part C is offered by private. They're contracted with Medicare, with the government, to be able to provide Medicare coverage, but they are managed by private insurance companies. Whereas again, Parts A and Part B is managed by the government. And then Medicare Part D, this covers prescription drugs. And that's what it's known for. So these are the 4 parts of Medicare. Again, this is just a basic overview. I'll have other details where I will be going into more detail. And like I always say, definitely feel free to leave comments down below with any questions about your situation, or if there's some videos you would like to watch as well. But it can certainly be helpful to speak to someone, so I certainly understand that if that might be helpful for you as well. So one of the most important things you can do as a Medicare beneficiary is to upgrade your benefits as often as you can, or at least be reevaluating them as often as you can. And it's actually easier than you might think. So with plans and benefits updating year after year, if you're not reviewing your coverage regularly, you could be missing out on some important benefits that are offered by the major providers in your state. For example, oftentimes these providers will compete with each other to try and offer better benefits, and this can happen on a yearly basis. So bringing your current Medicare plan up to date can be kind of daunting. It can be kind of confusing, trying to figure out which one might actually be the best for you. But fortunately, there is a super simple way to get the most recent benefits without having to call millions of companies or even spending endless amounts of time scrolling through the internet. So Qualified Medicare is a completely free, it's a no obligation helpline to give anyone on Medicare the information they need to take advantage of all these benefits. So if you're wondering if there are better plans available, or worried that you may not fully understand your current Medicare plan, or you're just kind of curious as to what other benefits you could get at no extra cost, well then you can go ahead and again call this toll-free Medicare hotline number, which is on the screen here. Also, we'll put the phone number down in the description below. And then one of the licensed agents will be happy to answer any questions you might have and basically help you find the best coverage that's available for you and for your particular situation, because it actually is very easy to switch your plan on the spot, again, if it's in your best interest. And that's even if it's outside of the annual enrollment period. So ultimately, if you do have any additional questions or if you'd like additional help, first, don't hesitate to leave a comment down below. We love getting to answer and try and help out as much as we can. I'll include any additional resources in the description as well, including the number to the hotline where you can call and speak to someone and get all of your questions answered that way so they can listen to you and your situation and help you figure out what's going to be best for you. But otherwise, thanks so much for your time. Really appreciate you guys watching. Hopefully this was helpful, and I'll look forward to seeing you in the next video.